Hello, Pharma aspirants. Welcome to Pharma Syndrome YouTube channel. Let's have a short review on the acetyl salicylic acid, that is aspirin. So that is aspirin, ASPRIN. So as you know, acetyl salicylic acid is a one of the NSAID, that is non-steroidal anti-inflammatory drugs. So there are steroidal anti-inflammatory drugs are there, non-steroidal anti-inflammatory drugs are there. So steroidal anti-inflammatory drugs like glucocorticoids, which having a steroid nucleus in their structure, but here it is the aspirin, nothing but chemically acetyl salicylic acid, does not having any steroid. That's why these are non-steroidal anti-inflammatory drugs. And as you know, aspirin having different application and clinical uses. So let's see. So by the name itself, ASPRIN. So that is ASPRIN. So A means acetyl, S means salicylic acid, PR. So leave the I. PR means prostaglandin, and IN inhibitor of prostaglandin synthesis inhibitor. So by name itself indicating acetyl salicylic acid is a prostaglandin synthesis inhibitor. So how it inhibits prostaglandin synthesis? By inhibiting the COX enzyme, that is cyclooxygenase enzymes. There are three types of COX enzymes are there. COX1, cyclooxygenase 1, cyclooxygenase 2, and cyclooxygenase 3. So cyclooxygenase 3 is mainly present in the brain. So like that you may be studied in the books. And the COX2 is mainly involved in the inflammatory reactions. And COX1 is having housekeeping role, that is protective function in the gastrointestinal tract. So as mechanism, it is a prostaglandin synthesis inhibitor. This is the acetyl group. So this is the acetyl group, and this is the salicylic acid, that is acetyl salicylic acid. So acetyl salicylic acid is a prostaglandin synthesis inhibitor. So for inhibition of prostaglandin synthesis, the acetyl salicylic acid inhibit the cyclooxygenase enzyme by causing acetylation. So this acetyl group binds to the serine residues of the COX enzyme. Serine residues of the COX enzyme. So serine is a hydroxyl group contain amino acid, and this acetyl group, especially O, will bind there. So this acetyl group causes irreversible acetylation of COX enzyme and prevents the prostaglandin synthesis. And aspirin is the only NSAID causes irreversible inhibition of COX enzymes, and remaining all NSAIDs are reversible inhibitors of COX enzymes. And here also, by the name itself, let's see some side effects of the aspirin. So here the aspirin causes asthma. Aspirin can irritate the bronchial smooth muscle and leads to asthma. And S means salicylate intolerance. Excess dose of aspirin may increase the salicylic acid concentration. That also having some other allergic type reactions. And next, P. So the aspirin can produce the peptic ulcer by producing the gastrointestinal bleeding. And here I means intestinal bleeding. I already told that. So aspirin can increase the gastric bleeding by showing negative effect on the platelets, prevent the clotting mechanism. And the P means aspirin can produce peptic ulcer because aspirin inhibiting the prostaglandins. If prostaglandins was inhibited, COX enzyme inhibited. If a COX1 inhibited in the GIT, so COX1 is a protective role in the GIT. But if COX1 of the GIT inhibited, there is a chance of peptic ulcer. And next, Ray syndrome, especially if the children having age below 5 years, if they are using aspirin, there is a chance of developing a Ray syndrome, especially using of aspirin in viral infections of the children. And I means idiosyncrasy or idiosyncratic reaction. There is a no proper reason behind the particular side effect. And N means nose bleeding. So there is a chance of nose bleeding if Aspirin is continuous use or aspirin at high dose. So this is simply review or short revision on the aspirin. I hope you have knowledge and you can easily remember. Subscribe to our channel for more interesting updates.